Hi everyone, this is Renee Alexandra from Brandman University. I'm about to talk to you guys about health communication campaign that's focused on depression awareness for the Latino population of Ventura County, California. The agenda that I'm going over today is going to talk about at-risk population and the subpopulation, health issues that are centered around depression, and the theory that I chose for my health communications, examples of different multimedia approaches for this health campaign, and a list of references that I have found to help me put this presentation together for you all. Here's a description of the county. This is Ventura County. It's located inside of California. It's one of 58 counties in California. Inside of Ventura County, there are 23 cities. The largest cities in Ventura County, the population-wise, is Oxnard. That's actually where I live. I live in Oxnard, and it's very populated. In regards to area and square feet, Thousand Oaks is a city that's largest. There's roughly 850,000 people in Ventura County. It's a pretty big county. It's 11th most populated in California, and it consists of 1.2 million acres. It's pretty large. This is an actual picture of Ventura County. That's the Pacific Ocean there that you see on the right. That's the pier that you see there, and that's going right there. This picture is taken in the city of Ventura, and far off to the distance you can see that's Oxnard, and you can see how dense the community is there. So the at-risk population and the subpopulation that I'm focusing on is depressed patients or depressed people for the underserved population of Ventura County, and the subpopulation is Latinos. This at-risk population, they suffer from culture shame. Many people in the Latin community, including myself because I'm Latin, we oftentimes don't accept one another's openness about mental wellness and in particular depression. We oftentimes call it nerves. In Spanish, it's called nervioso, nerviosa, and oftentimes providers will misdiagnose what this is and not relate it to mental illness, and it's often misdiagnosed. So there's a lack of acceptance from our family and our peers. There's a lack of awareness. So many people don't even understand what that feeling is inside of our thoughts and in our minds and in our bodies, and can't relate it to it being mental wellness. There's a lot of myths associated with it. And oftentimes this population, it's not on their priority list. They are more focused on putting a roof over their head, putting food in their bellies and for their families, and it's not a priority for them to go to the doctors and seek mental wellness, and it's something that they can't afford. So it's difficult for them to have access to care. Oftentimes this population in particular, because they are underserved, it's oftentimes because they're concerned about their immigrant status, their legal status regarding immigration. And to top it off, once they finally do make it to a medical provider's office, there's so many language barriers. Despite in California, we're required to provide services to patients based on their native language. Realistically, I work in a medical office, and it's very difficult for providers to carve out time for patients that don't speak the provider's native tongue, because they're hindered by seeing patients every 15 minutes, and realistically they're only carved out 5 minutes of that time, and to try to get an interpreter on the phone is very difficult. Oftentimes what we see are grandparents coming in with their grandchildren to translate, and how real and authentic are those patients going to be with the provider to open up honestly when they have their grandchild translating? So there's a lot of risk factors for this population to receive mental health services, and in particular to seek care for depression. Approximately 33% of Latino adults with mental illness received treatment each year, compared to the US average of 43%. So that's a 10% difference there. Without treatment, certain mental health conditions can worsen and become disabling. This is from the National Alliance of Mental Illness this year in 2019. And this actual website, the National Alliance of Mental Illness, provides so much information for the Latino population and in regards to mental wellness. Health issues regarding depression in Latinos is not talking about mental health and depression, and it increases a stigma. So when we're not talking about it, it just further makes this difficult for us to provide care and for patients to seek care. There's such a huge lack of information. I discussed a little bit of that in the other slide, but to go more in depth about that, behavioral health services is not receiving a lot of funding, so there's not much outreach to the community. And the outreach that is out there is in the English language. There's not much language in the Spanish language, at least here in Ventura County, that I've gone out to the community and witnessed for myself. Our community, the Latinos, are very private. They don't like to discuss their personal business with anybody, including a provider or a doctor. And they are very much in the mindset that we don't like to air out our dirty laundry, and that's what we do when we are seeking mental wellness. We're talking about our personal issues and personal beliefs and thought processes, and it can be frowned upon by the community. And I talked quite a bit about the language barrier, but again, that is a health issue that prevents them from seeking care. I have here listed a machismo culture. So what I mean by that is that there's such a pride with the culture that they're not ill, a very strong culture, and it's frowned upon to appear less than strong. And so when you're talking about the mind, your mind needs to be strong, and you can't admit that you are weak-minded in even though you're not weak-minded. That's a myth and the concept that comes about when they are talking about mental wellness and not having anything less than perfect in their minds. They have this machismo culture. I chose to talk about Dorothy Orum's self-care deficit theory for health is health communication for this topic. The self-care deficit theory is a grand nursing theory that has been developed by Dorothy Orum between 1959 and 2001, which is the chosen theory to apply to this problem. The self-care deficit nursing theory is widely used to improve quality of care for patients within the nursing discipline. The central philosophy of Orum's theory is that self-care is a human need, and self-care deficits require nursing actions. According to Orum's self-care deficit theory, humans must engage with themselves and their environment to be functional and remain alive. Often this is difficult when someone suffers from depression. The application of Orum's theory to clinical practice is to understand that nursing is a human service, and nurses design interventions to provide or to manage self-care actions for sustaining health or recovering from illness or injury. When patients are unable to meet their universal self-care requisites independently, a deficit exists, which then requires nursing interventions to assist the patient. In this case, when depression outweighs the patient's ability to provide self-care or even have the support or education available to identify and treat depression, a deficit exists and a nursing intervention is required per her theory. When self-care deficit exists, the nurse identifies that the patient requires support via 3 modalities: educative and supportive, partial compensatory, or total compensatory. Communicating to Latino patients in Ventura County that it is okay to be screened and treated for depression is the goal for this health campaign. Nurses will in turn identify interventions, whether it solely be support and education or total support, to assist him or her with their depression. Dorothy Orum's theory is an excellent theory in assisting patients with depression. These are 3 examples of multimedia approaches that I've found on the websites out there for Latinos and depression and mental wellness. This one here, the Compartiendo Esperanza, speaking with Latinos about mental health, It's a bilingual 90-minute presentation that can help increase mental health awareness in Latino communities by addressing a number of important topics. NAMI, Ending the Silence, a mental health awareness program for teens. It's a 50-minute interactive presentation that's designed for teens. And the World Health Organization has a huge health campaign that's geared around depression and trying to encourage patients to talk about it. It's a short video and it highlights the public health and economic arguments for ensuring that treatment for depression is available to everyone who needs it. It was produced by the World Health Organization and it started in October 3 years ago. Here's a list of the references that I used, and I hope that you've learned something new and enjoyed this presentation. Thank you for staying and watching.